representatives of state government, distinguished guests, professors, doctors, nurses, stakeholders, ladies and gentlemen. It's my honor to welcome you all to this significant gathering, which is the official presentation of findings from IVON-PP study, intravenous ferric, carboxymaltose versus oral ferrous sulphate for the treatment of moderate to severe postpartum anemia in Nigerian women.
So this research for me, it is about Nigeria. This is about our own women. This is about what works for us in all the different parts of Nigeria.
People have worked hard on this project. We started it in 2022. The IVON-PP, which was the sequel to the IVON trial itself. And, it was fantastically done. And I'm so grateful to everyone in the room.
This research, not only is it going to help our women, but it's actually going to set us apart from other maybe countries in Africa.
Lagos, Kwara, Rivers, and Kano states, of course. And we'll be wondering why these 4 states. It's because these were the states where the IVON-PP trial were actually implemented across 5 sites in each of the states, giving us altogether 20 facilities in total. And of course, the sample size was 1,400. That was the postpartum women were enrolled, 1,400 postpartum women with moderate to severe anemia. From this trial, we have key achievements: the evidence-based solution to postpartum anemia, also capacity building. This trial has also achieved a lot. It's not easy achieving the fact that we can boast that we have been able to train. We have over 100 of research staff that we can call clinical trial experts. If I have a way of having a placard over my head to just hold it to present this, I don't mind, because it's something I really want to push out and pronounce that yes, the IVON-PP trial really achieved. We achieved an outstanding retention rate of 98%. Please, let's not forget that we were following them up until 6 months. We followed them at 2 weeks, we followed them at 6 weeks, at 12 weeks, 6 months, and we were able to achieve an overall retention rate of 98%.
Our aim was to determine the clinical effectiveness, tolerability, and safety of using these 2 medications, that's the intervention drug, intravenous ferric carboxymaltose, versus oral ferrous sulphate for the control drug, in treating moderate to severe postpartum anemia in Nigerian women. What did we do? I want us to pay attention to another thing. A single dose of a medication was administered at enrollment, and then women were followed up to 6 months. While for our normal drug that we use, the oral ferrous sulphate, the women will take in the morning, in the night. But unfortunately, remember what I said happens in women that have postpartum anemia. Cognition is impaired because of this state. They have a baby to care for, they have themselves to care for. They tell you they forget to take the medications. We will see most of them in clinic, do not remember, and then she comes back. At the end of puerperium, she's still anemic. So what does that mean? We need to do something to work against this. Now, what did we find? The primary outcome. At 6 weeks, only 17.6% of the participants were still anemic. So out of 100%, close to 83% of them had normal blood levels at 6 weeks postpartum. And then at 6 months postpartum, this further reduced. Only 15.8% still were anemic. Looking at the control arm, we had 32.3% of women. And this was because we had to follow them closely. So if it was our normal practice that we would do, and the women just come and saying they had forgotten, these values would definitely be higher for those that were on the oral medication. And even at 6 months, the value, yes, although still low, but was still higher than the IV one that we had. And then the need for blood transfusion, we saw that less women in the intravenous arm had blood transfusion. Not forgetting also at the beginning, those that had severe anemia were more in the intravenous arm. And also those that had infection in these 2, which was one of the concerns that people have for intravenous iron. People were saying, oh, if you give a load of iron, people will be at risk of infection. We could see that even in intravenous arm, also from this chart that is up here, we had less women with that state in this trial that was done. Something to note in the secondary outcome for the neonate, we can see the amount of infant deaths. In total, I'll just go to the total value, which is 22 in the intravenous arm and 6 in the oral iron arm. Many people will assume that probably because women had the drugs. No, But funny enough, the babies that died, more of them, none of them in short, none of the babies were breastfed. That was what we realized. So the babies never had contact with their mothers. So it's not as if breast milk or the drug was passed in the breast milk to the babies, no. But the causes of death we identified were still the causes of neonatal mortality, prematurity, birth asphyxia, congenital anomaly, which is what we already know, which points that we still need to focus on the neonates and focus on these things. So that means research in that aspect is of importance.
The summary of our baseline findings was there was high perceived feasibility due to available trained healthcare workers. The acceptability of FCM was anticipated, but hinged on patient awareness and ability to get consent. And community engagement was identified as key to promoting acceptability. So, summary of the endline findings. FCM was found to be acceptable and feasible across all the study states. The healthcare workers were confident because of the continuous training that was given to them, and they reported minimal complications. And overall, there was high readiness to adopt FCM within Nigeria's mental health framework. So on a larger scale, they were very optimistic that FCM would do the maternal health good.
We've been able to learn a lot. I can stay here and give you like multiple things that we've learned. It's a lot actually. So, but because this trial, being able to conduct it up until now, it wasn't easy. Ensuring robust monitoring system is something that you need to ensure that everyone is involved. Independent bodies are involved. External bodies are involved. That's to ensure transparency in your results. You'll hit your chest and say you've been able to achieve evidence-based results.
So it would be nice that following this, policy changes will now come in. I know during the discussion, talking about putting it in an essential drug list. If that is able to be achieved so that every postpartum woman that has anemia has access to this medication, that would be great. And then give better outcome to our mothers too.
Gratitude is the best attitude. And it's also been said that when gratitude is not expressed, it is like a gift that you wrap but that you did not present. So we have to express our gratitude to each and every one of you for the time you have spent with us today, and from the time you've been with us since 2022 when we conceived and started this project.